We're here at the Swindon Intermediate Care Centre just next to the Great Western Hospital. The reason we've come here is they're about to open a new therapy garden behind the centre. This is for the use of patients of the centre to help them in their recovery. The care centre itself opened at the same time as the Great Western Hospital next door, but due to a lack of time and resources, the garden area behind the centre was never properly developed.
We hadn't really completed everything when we moved in, and I suppose the garden, we did have the rehab area, we did have our steps, we did have the ramps, we did have those raised beds, but that was it. This was just left, there was no planting, there was nothing, it was left bare. And this was grass here originally, but it just went to weed very quickly. And we were having to concentrate on our actual patients inside.
For the last 2 or 3 years, we've wanted to look to expand the facilities here and really to make it less like a hospital unit and more a friendly, sort of all-encompassing, more homely environment for people. And part of that was to try and develop a garden that patients would feel comfortable using, would be able to come out here with the therapists, undertake a bit of gardening, and get more of an environment that they would find at home. But of course, as much as we would have liked to have done that before now, it's finding the money to do that. And unfortunately, with NHS finances as they are, things like this, although they are very nice to do, aren't necessarily at the top of the list of things we have to do.
It was always on our list of things to do, and this is where we were so lucky that the Wilson Trust came forward and said they had some money to spend on improving patients' experience. And I thought immediately, I realised the garden, obvious choice.
The Swindon-based Dr. T.C. Wilson Charitable Trust was looking to spend some money on improving facilities for patients in hospital. They were interested in the Intermediate Care Centre and had seen the incomplete garden.
Which struck us when we first saw it as in much need of improvement. It seemed a rather soulless place, and we wanted somewhere which would be where patients could get, if you like, rejuvenated, get pleasure from, and it'll be part of their recovery that they'd have a nice garden outside which in good weather they could enjoy.
Gardens are very peaceful areas. They're nice to relax, and most of us enjoy being in a garden. Patients who are going through rehabilitation, their lives have changed. They're coming to terms with things, that life might be different, it might not be the same again. And having something nice to look at. It's the autumn now, so we don't have too many flowers in the garden, but it can be nice. Also, like the sound of water, it's therapeutic. It's so just for body and soul and mind, just sitting out in the garden with your relatives is nice.
I am now going to declare this garden open.
The opening was attended by patients, staff and some of Swindon's most influential citizens.
It's so important, I think, gardening. It's got a spiritual side to it, but also it's really, I think, amazing if you had a stroke or you've had a serious illness, and you can come out into a garden and see whether you can grow things and see things flourish and flower. And it's just very peaceful out here as well. So I think Swindon people will really appreciate this facility.
I think it's of tremendous benefit for the users of the SWIC because it gives a really pleasant, tranquil setting which will, I'm sure, aid recovery of SWIC patients. A lovely, tranquil setting to come out and spend some time in.
I've been speaking to a number of the patients who have been out here and using the facilities, and they were saying just how nice it is to come and just sit and relax and have a bit of me time sometimes when you want to get away from the ward and everything that's going on around you, and just be able to sort of sit and enjoy the environment.
Brilliant. Somebody go and sit now when we got time to spare. It's beautiful. It's just put a finishing touch to it as far as I'm concerned.
The garden will be cared for by the hospital's gardeners, as well as the staff and patients of the Intermediate Care Centre itself, and should provide a therapeutic and tranquil haven for years to come.